Hello, everyone. I'm Gilbert Burnham, and I'm Professor of International Health in the Bloomberg School of Public Health at Johns Hopkins. And I'm joined today with Ashu Mishra. And Ashu is in the Department of Health Policy and Management, also in the Bloomberg School of Public Health. And our intent today is to talk to you about the basics of the U.S. public health system. And we're doing this to give you an understanding of where there are employment possibilities for health professionals coming to the United States. And our goals are to give you this overview of the system, particularly for people looking for employment. We want to look at the various sectors within the U.S. health system with enough detail so you'll have some orientation to see how these various sections fit together. We want to also give you an idea about where there may be employment opportunities in the system, both as a short-term option and also where are some potential longer-term goals in the system. We also want to transition from this into looking at the various pathways that one could pursue as a medical professional coming to the U.S. and looking for employment, and where are the next phases in the program. So this is what the course will look like and how it fits together with the other parts from our partners. We'll start off by talking about the introduction to the U.S. health system. Then we'll talk about some pathway identifications, and we'll be working with our partners for this. Then we'll look at the options for mentorship, where we can find mentors to help you as you're pursuing the goals that you have for employment in the system. We'll look at where there are potentials for networking, for specific assistance. We'll look at where there's possibilities for getting additional technical skills. And there are a number of courses available that can be accessed with no cost to you that will help you build up particular technical skills for employment that you're pursuing. There's a lot of soft skills as well, how to survive in the system, how to present your resume, and how to make a good interview. And so all of this will lead us to our goal of helping you with a job placement opportunity. So in our discussion, we'll talk a little bit about the overview of the system, particularly the healthcare system. Who are the payers, the providers, the biotechnology? We'll talk about population health areas. These are the areas of public health, things that are very close to our goal at Johns Hopkins Bloomberg School of Public Health. And there are a number of related social services involved, and we'll talk about those as well. Then there are a number of other aspects of the health sector that are adjacent to these particular areas. These are such areas as clinical research, academic research, information technology, regulation, and finance, and we'll touch on some of these as we go through the course. So this program is a collaboration between three organizations, and we're speaking to you on behalf of Johns Hopkins University, specifically the Bloomberg School of Public Health, but our partners are Upwardly Global, and this is a NGO that helps foreign graduates and professional areas with placement. And then our other partners are AMPA, the Afghan Medical Professional Association of America, a well-established organization with many networks and chapters in different parts of the United States. And this was designed to meet the needs of the increasing number of Afghan health professionals who've come to the United States from Afghanistan, but it also applies to many other groups coming to the United States for the first time and looking for employment in the health sector. And our goal is to help the health professionals joining us from overseas to be able to find the optimum employment in the U.S. health system that will meet your needs and your professional aspirations. And with that, I'm going to turn it over to Ashu to lead us through a discussion of the U.S. health system.
Hello, everyone. My name is Ashu Mishra, and I am a MSPH student studying health policy with the Bloomberg School of Public Health. Today, we're here to talk about the U.S. health system, so we'll start with an overview. So to give an overview of the U.S. health system, In 2020, the US spent $4.1 trillion on healthcare, accounting for about 20% of GDP, or gross domestic product. That means that almost 20 cents of every dollar were spent on health and healthcare. The US spends the most money per person on healthcare of any other country, but we do not have the best health outcomes. We have excellent healthcare quality for people who can afford it, especially for people with complex conditions like cancers and heart disease. However, for people who are uninsured and underinsured, they face substantial financial barriers to access. So where does all of the money in the US health system go? About 31% of it goes to hospital care, 15% goes to physician services, and 10% goes to prescription drugs. The remainder is spread across the rest of the US health system. Now, who are the main people that patients interact with? So the first stakeholders that we'll talk about are payers. Payers are the entities responsible for funding healthcare, including public and private insurers. Second, we'll talk about providers. Providers include the sites of care where healthcare is delivered, as well as the people working in those sites. That includes physicians, nurses, and so on. Lastly, we'll talk about biotechnology. Biotechnology encompasses the research, development, clinical trials, production, and commercialization of health-related technologies. Primarily, this includes pharmaceuticals and medical and surgical devices. To contextualize these three stakeholders, they operate within a broader environment of population health and legal regulations, as well as with health-adjacent sectors. So population health on the top, that includes public health and related social services that influence how patients not only interact with healthcare systems, but how their health is shaped. The legal regulations also shape this environment. And then on the right, we have health-adjacent sectors, including academic research, information technology, and healthcare startups and finance, that all play a role in the broader health system.